So this is the PRP, the concentrated platelet-rich plasma, and I'm injecting into the scalp to regenerate or rejuvenate follicles that are thinning. See, there's some thinning here. So I want to get that follicle stimulated with more, if the platelets. The platelets have growth factors to get more growth of the follicles, the keratinocytes that produce the hair. So I'm going to try to inject that so the hairline won't show too much thinning here. Multiple injections. Of course, I also did the superior orbital block. So that's the nerve that comes up and innervates the front of the scalp. And those has been numbed up here too. I've done this myself, of course, so I understand it hurts a little bit, but you know, with this nerve block, it's still tolerable. It's quite a pressure sensation, pricking, of course. So another syringe in. I'm going to use another 5 cc and then do on this side of the scalp. This is what I do to myself, actually. So I have it with that gun. See, with that gun has a syringe that's there, and then my staff just injects me right there, where this is loaded in the gun, and it will inject really tiny aliquots into the scalp. So, and then we'll microneedle it. We'll show that right now too. The plasma will be microneedled into the scalp about almost 2 millimeters in, where the hair follicles are living, and you want to nourish it. So you're putting fertilizer onto the roots and then having it grow. This is like you're planting seedlings, and of course there is this is this rich soil bed of the scalp, very vascular, but you want to use platelets that has the potential to stimulate, and therefore you're soiling it, seeding it. But it causes injury, so it's a lot of micro injuries, right? So the body repairs itself by making more of its own with the injury. So what? Either it forms collagen, that's how it repairs itself, or it forms whatever's there. What's there? Well, hair follicles, the root of the hair follicle. So it will repair itself by making more because you have injured it. Okay, good. So let's get that thing on microneedle. Wait, you gotta get tiny needles going really at a fast speed, oscillating, and I'm trying to making pokes, like extremely micro channels of pokes into the scalp with using these micro needle pen. So this is a microneedling device to inject it right into the scalp. At a depth, a certain set depth. So the depth I set is 2 millimeters where the hair follicle will live, and I'm planting all these plasma with the nutrients right down to the hair root. Thank you very much. And we shall see the growth in about 6 weeks to 2 months. And then thereafter, patient comes back and repeat the treatment, and therefore it gets a better effect. The more consistent patients do it with this, obviously the better effect. You don't expect to get it done with 1 or 2 times. Usually a cycle of 3 has a good reforestation of the hair. Thank you. This is PRP Hair Restoration.